It's time for our nursing tip of the week, and in this week's tip, we are talking about all things code card. So I need to mention, I just got back from the eye doctor and I got my eyes dilated. So don't mind the fact that my eyes are huge, and also the ring light is really messing with me. So I'm gonna just do my best. I feel like the code card is pretty intimidating when you look at it, and when you're in an emergency situation and everything's kind of chaotic, it's not the best time to learn about the code card, which is why I'm gonna teach you about it right now. But also, I recommend you look at your code card that's on your unit, know where your code cards are and what's on them, how to unlock them. That way you're not trying to figure everything out. Before we talk about the code card components, I want to say code cards are typically plugged into the wall, or at least like the defibrillator portion is, sometimes the suction portion is. And so you want to make sure when you pull your code card away, unplug it from the wall, or else it's just trust me, I've done it where I've ripped it from the wall and it was just not the prettiest sight. All code cards are going to be slightly different, but most of them should have the majority of the things that we're going to talk about. First thing first, you're going to have a defibrillator on your code card. Again, make sure you unplug it. There should be pads. We have our pads already connected to our defibrillator, and usually there's additional pads on there as well in case of something goes wrong with these first set of pads. There's also portable suction on the code card. This is also plugged into the wall, and portable suction is one of those things that you don't typically need it until you really need it. So we always double check this on our code card checks to make sure it's working, because when it's not, it's usually we're scrambling. Got our code sheet here, multiple code sheets in case we need to use multiple pages. And then we also have gloves. This is a little binder for our code card checklist to make sure everything's working. You can see an oxygen tank in the back as well. There's a CPR backboard on the front of the code card that you're able to kind of just lift out to place under the patient. And then there's multiple drawers that have multiple things in them, and we're going to talk about those drawers. You go to open up the drawers, there's this little tag right here that you're going to have to rip off, or you can actually just kind of slam the thing to the side, and it should easily rip off because it's basically like a wimpy zip tie. Our top drawer has all of our medications in it, your epi, your bicarb, your calcium, etc. After the next code that you experience in your hospital, definitely look in these drawers, so that way you don't have to crack open a fresh code card just for that. That way you can get familiar with what's in it. These next three drawers have extra supplies like suction tubing, IV bags to mix medications, primary tubing, needles, syringes, etc. Highly recommend looking in these as well. The sharps container over here, and then actually on the top of our code card, kind of underneath all of this, is where we keep our respiratory supplies like your ET tubes. Also have a side drawer on the code card that has our extra IV fluids and stuff. Let me know if you have any more questions because I'm running out of time, but that is your tip of the week.